On-the-scene coverage of ACC 2015 is supported by Effient.
I'm Peter Block for On the Scene here in San Diego at ACC 2015. With me is Luigi DiBiase, the lead author in the Aatac AF trial, a trial with multiple investigators in the United States and all over Europe. Luigi, tell me about this trial. What is this trial about? Ablation versus amiodarone, as I understand it.
Thank you very much. First of all, I would like to thank all the co-authors and the principal investigator, Dr. Natale, for giving me the opportunity to present this trial. So this trial is a trial that has enrolled patients with left ventricular ejection fraction dysfunction. So these are all patients with heart failure that are implanted with a device, either an ICD or a CRTD, that develop atrial fibrillation. And these patients are randomized to amiodarone treatment versus ablation treatment. So this study was designed in the purpose that staying sinus rhythm is better in patients with heart failure than staying atrial fibrillation. So how to achieve sinus rhythm? We have anti-arrhythmic medication that are very limited and left to dofetilide and amiodarone, and we have utilized amiodarone as the arm versus ablation of atrial fibrillation.
Okay, and the ablation, as I understand it, was also up to the discretion of the operator, either pulmonary vein isolation or ablation or both, right?
Yes, the ablation was left to the discretion of the operator and was at least confined to pulmonary vein isolation, but the operator could do more, the so-called PVI plus, which included for some the roof, the posterior wall, the coronary sinus.
Okay, so tell me what you found.
So we found that in patients undergoing ablation after 1.4 procedures, so not only after one procedure, but after multiple procedures, the ablation arm was able to reach a higher freedom from atrial fibrillation when compared to amiodarone treatment.
So ablation is better than amiodarone, but when I looked at the data, I also saw that the ejection fractions in patients that had sinus rhythm were improved. Would you comment on that?
Yes, this is actually a secondary endpoint of the study where when sorting the results by recurrence, no recurrence, all patients that had no recurrence improved their clinical parameters from the ejection fraction to the 6 minutes walking test to the Minnesota Living Questionnaire. And in addition, when looking at the recurrence, we find out that patients performing a PVI-only ablation had the lower success rate than when performing a more extensive ablation.
Okay, so it sounds to me like the summary of this trial would be that if you have atrial fibrillation, pulmonary vein isolation plus ablation beats amiodarone, and in this trial by a long shot. Thank you very much, Luigi.
Thank you so much.